Hi, I'm Kathy Burgess, and today we're going to be talking about safety with your EVD. First thing, with any EVD, we want to make sure that you have a clamp and some 4x4s hanging on the pole. And this is just in the event that there is some sort of a breakage in the system. And in that case, we would be covering the actual drain itself with the 4x4 and the clamps to prevent any air from getting into the EVD and infection. If the drain does get disconnected, we want to make sure that we clamp it and cover it and get a new setup and call the surgeon to come and hook up the new one, because it's against it's out of the scope of practice for the RNs to reconnect the EVDs. Okay, so clamps and 4x4 is number one. Number two, we want to always make sure with these EVDs that we have this extra string here that's on the pole to help prevent it. It's already clamped onto the pole, but this string will just prevent it from falling out of place so that it doesn't fall, the level doesn't change at all. Tegaderm the EVD to the shoulder. So in the event that the EVD is in, we want to make sure that the Tegaderm is here so that it doesn't get pulled at the site. So always Tegaderm. We sometimes will put a piece of gauze underneath this stopcock here just to prevent any kind of skin breakdown. So that will just kind of secure it there to the shoulder. The next safety feature for our EVDs is this sign that we'll have above the head of the bed. This is the caution sign that allows all the people who enter the room to know that there is a level sensitive drain in place, and we don't want the head of the bed changing position without the nurse being consulted first, and this would prevent the drain from over or under draining. Another safety feature with the signs is sometimes there is an EVD that goes along with a hemicraniectomy where a piece of the skull has been removed. And in that case, we want to have this sign here that would tell if it's on the left or the right bone flap. And we would not want to turn that patient onto that side to injure the brain. So we want to make sure also with patients who have a hemicraniectomy that they always have a helmet when getting out of bed, and that is just a safety with a bone flap itself, not necessarily with an EVD. So those are the two caution signs that we would want to have. Another safety feature that we'll have in the event that the doctor has ordered the EVD to be clamped, this alarm here needs to be put on. So in that case, you would hit the alarm and turn it on like that. And so then that little thing would go away. And this would let us know if the EVD was disconnected or anything else was wrong with it, okay? So another safety feature with EVDs is we always want to have the INO paper on the door. This shows the 24-hour drainage that is collected from the EVD every day. Night shift is responsible for putting that value on here so that the doctor can see it in the morning to let us know if we're getting ready to take the drain out or not.
So you guys have a lot of neuro patients out here.
So another safety feature with our EVDs is we always want to make sure that the secondary wave is on the central monitor the ICP shows. And so what you're going to do is we're going to get onto the thing and right click, and you can put you're going to put change wave, and then I'm going to change it to ICP, so that I can always see my ICP waveform here, and that way I would know if the patient is supposed to be draining, I'm not going to see a waveform, but if you see a waveform and it's supposed to be clamped, or if you see a waveform and it's not supposed to be clamped, it kind of alerts the unit that we have a EVD that's clamped that shouldn't be. So it's just a safety feature that we would have out here. Thank you.